Hey Gully Squad, welcome back to 70 Pounds of Life. If you're new here, my name is Marissa Dunn and I have lost over 100 pounds and it's all been documented right here on YouTube. So go and check out those weekly weigh-in videos. So now that I am down about 120 pounds, you guys know that I've been looking into getting a tummy tuck. So let me go ahead and start this video off with this. It just needs to be said. I am not here trying to influence anybody to get any type of cosmetic surgery. I'm just here documenting my own journey and basically just being transparent with you guys about what I am doing in these next steps of getting the loose skin removed. If you want to know why I want to get my loose skin removed, I have a previous video on that, so you can go and check that out. Let's go ahead and jump straight into today's video. I had a consultation that I told you guys that I was going to film the entire thing. It was a video consultation with a doctor named Dr. Kuber, who works with Athenix Body. Athenix Body is a fantastic company that I have been following on social media for a very long time, and I wanted to get a quote from them. There's a lot of questions that you guys had in the comments that you wanted me to ask the doctor, and then there were also a lot of questions that I had personally for myself. So if you guys are interested in pricing, don't worry, I am going to tell you guys what the pricing is. Speaking of pricing, so I mentioned it in a previous video, I obviously need to get some money to pay for this, right? It's expensive. So what I'm doing right now, all of my workout guides, all of my t-shirts, any bottle that you purchase, any one-on-one consultations that you purchase with me, since I am a personal trainer now as well as a weight loss specialist, all of those things are going straight towards my tummy tuck. And just to be even more transparent with you guys, I need to I need to come up with $4,000 in the next 12 weeks. So if you guys wanna help a girl out, purchase a t-shirt. I got 5 new designs. They're only gonna be here for another week or so. So go and scoop those up. Not to rush you or anything, but they really are going away in a week. Okay, so if you like one of those designs, grab it before I post the new designs. All right, so let's just jump into this video.
What are the most common complications with tummy tuck and breast lift? I wouldn't say these are complications. I would just say they're consequences of these procedures due to their nature. For example, seroma or fluid collection is rare after tummy tuck, but it's something that can happen due to the nature of tummy tuck, where someone develops a fluid collection, what we call seroma. But I do use drains, which reduces the likelihood of seromas. It can still happen, but because I use drains, it's something we hardly ever see.
Okay.
With a breast lift, something that can also happen is what I call delayed healing. You can have an area, usually underneath the breasts, where the incisions come together with a T. That can take more time to heal than other areas, and it may require some antibiotic ointment or dressing changes. But delayed healing is one thing that can happen after breast lift. But in terms of complications, we don't really see complications necessarily, but after tummy tuck, seroma is just a consequence of tummy tuck, just due to the nature, but it's very rare because I do use drains.
Okay.
The drains are kind of annoying, but they're an important part of the healing process after tummy tuck. But the drains have to stay in for approximately 7 days, and then we take them out here. But you should, if possible, try to stay in the area at least, during the time the drains are in, which is usually about 7 to 10 days.
Okay.
Your second question with regards to breast implants. You can have a breast lift without implants. It's not absolutely necessary to have implants.
Right.
Even though they're incredibly popular and it's something we do all the time, it's not absolutely necessary. So you can have if you're happy with the size your breasts are, you can have a breast lift by itself and get a great result. It's not absolutely necessary to have implants.
Okay.
Because some women, they're not for everyone. Some women don't want them.
Right.
Which brings me to your next question, which is that although breast implants don't require any routine maintenance, they do get worn out from old age.
Okay.
And so they do need to be replaced at some point.
What is usually the lifespan on the implants?
The lifespan of the silicone gel implants we're using nowadays is approximately years.
Okay.
It's with the saline implants, which are filled with salt water. Those can span about 10 years. So a lot of people are under the impression that breast implants have to be changed every 10 years.
Mm-hmm.
It's really not the case. But much like a car, for example, breast implants get worn out from old age, and if that happens, they should be replaced. But for a woman who reaches the age of 40, you should start to have yearly mammograms. And they can clearly see the integrity of breast implants on mammogram. If there's any question about the integrity, sometimes an additional imaging study called an MRI is recommended.
Okay.
But although breast implants don't have to be changed at any point, they do get worn out from old age, but the lifespan is usually about 20 to 25 years. But in general, with a breast lift, you're not removing any breast tissue. In other words, you're not reducing the volume.
Mm-hmm.
You're just lifting a woman's breasts and tightening the skin and giving the breast a more rounded shape.
Right.
It's possible you may fit into a C cup bra after a breast lift, but it may be a B cup, which is one size smaller in volume. It's hard to predict.
Yeah. Okay.
But what I recommend is to have a breast lift. Most women are thrilled with the results. If you want to increase the volume of your breasts, the two options are either breast implants or fat transfer.
Okay.
But those are things that I would do later on once the breast lift is healed, usually about 4 to 6 months later.
Okay. Really quick question. I did some research on the fat transfer. Is it correct that usually about 30 to 40% of the fat that's transferred dies off?
It's true that some of the fat that we transfer, whether it's to the breasts or butt, does get absorbed. It doesn't necessarily die off. It just gets absorbed by your body as it goes through a healing process.
Okay.
But it's true about 30% of it does get absorbed, whether fat is transferred to the breasts or butt.
Okay.
The nice thing is that the majority of the fat, perhaps 2/3 of it, does stay there, and it does stay there permanently.
Okay.
It doesn't go away over time. But in my experience, fat transfer to the breasts, it's not a substitute for breast implants. It doesn't give the same results because there's a lot of differences between fat transfer and breast implants.
Right.
With breast implants, they have a smooth surface, they go behind the muscle, they have a round shape to them, and fat is just a liquid. It doesn't really have any shape or structure, and it's placed within the subcutaneous tissues. So in most women, they get a better overall aesthetic result with breast implants than fat transfer.
Okay. So by looking at my photos, if I were to just do implants, would I still need the lift?
Yes.
Okay.
And the reason is that breast implants, although they make women's breasts larger, they don't lift women's breasts.
Okay, got it.
It's a common misconception that breast implants lift women's breasts. They really don't. The only way to lift women's breasts is a breast lift.
Okay.
So if you were to have just breast implants,
they'd be hanging pretty low.
Doesn't give the best aesthetic results.
Okay, yeah. That's what I thought. I just wanted to, check in with an actual doctor about it.
Right. It's a good question. It's something a lot of women ask. But whether a lift is necessary is really determined by specific elements of a woman's anatomy, specifically their nipple position, where it is on their chest. That determines if a lift would be necessary.
Okay.
To get the best results. With regards to the tummy tuck, you would likely require an extended tummy tuck, not necessarily a 360.
Okay.
It's true that many people who lose a significant amount of weight need the circumferential or 360 body lift, but in your case, if you're happy with the size and shape of your butt, there's really no reason to do anything.
Okay, perfect.
To your butt. But it's true that with a 360 tummy tuck or circumferential body lift, as I call it, it makes the butt look flat only because the skin is tighter. Okay.
Yeah, that's what I kind of was seeing from before and after photos.
But the reason why the butt looks flat after a 360 is because the skin is tighter, and also when men and women lose a significant amount of weight, they lose volume in their butt.
Mm-hmm.
So it's a combination of those factors that make the butt look flat. But if someone loses volume in their butt, we can restore that with fat transfer. It just usually has to be done separately from the body lift.
Okay.
With regards to drains or drainless tummy tucks, I always use drains. I place 2, one on either side of the tummy. I just find that it minimizes the likelihood of seroma. And they're kind of annoying, but most women get accustomed to them after a few days, but they generally have to stay in for about a week, and then we have people come back to the office at a week post-op, and we're usually able to remove the drains here in the office. With regards to muscle repair, you may not need muscle repair. It's something most women need, even though you haven't had children. Sometimes, after losing the weight, the muscle has a little bit of looseness or laxity, but it's something we generally evaluate at the time of tummy tuck.
Okay.
So it's done if it's necessary, but you may not need it, since it sounds like you work out on a regular basis.
Mm-hmm.
If you have good muscle tone in your abdominal muscles, you may not need muscle repair.
Okay. Yeah, I'm kind of thinking that I don't need it, but again, I don't really know.
When we do a tummy tuck, we're obviously looking directly at the abdominal muscles. So if it is necessary, I do the muscle tightening or reinforcement.
Okay.
But if a woman doesn't need it, then it's not necessary.
Okay.
Your next question with regards to the scar is a good question. The most important factor is that I put it as low as possible. It really has to be as low as possible, ideally, to allow women to feel comfortable wearing a 2-piece swimsuit.
Mm-hmm.
So I put it as low as possible because if it's too high, women don't like it because they don't feel comfortable wearing a 2-piece swimsuit. So one thing I like to do is have women, when I do the preoperative markings, is wear a bikini bottom they'd like to wear, and then I trace around that so that the tummy tuck scar or incision line will be hidden even in a 2-piece swimsuit.
Okay. And then for the shape of it, I'm guessing you're saying that it would follow that swimsuit, correct?
Right.
Okay.
Well, it has to sort of curve slightly upward. In fact, if you look at your tummy in the mirror, there's sort of a gentle curve to where the loose skin is. So
right.
I follow that curve.
Okay.
Obviously, the length of the incision is determined by how much loose skin a woman has and where it is located on their abdomen. But by far the most important factor is keeping that incision line as low as possible.
Okay.
You don't want it too high. And with regards to the belly button, as part of our normal anatomy, our belly button is attached to our abdominal muscles. And so when a tummy tuck is done, I leave that attachment intact, and I bring the old belly button to the surface of the skin through a new opening.
Okay.
And so that opening resembles the size and shape of your current belly button. So that it's really the size and shape of your current belly button that determines the size and shape of what it will be after tummy tuck.
Okay.
You can make it slightly more oval or slightly more rounded, depending on the woman's preference. But in general, I bring the belly button to the surface directly over where the belly button is attached to the abdominal muscles.
Okay.
So the belly button, obviously, you'll be able to see it in the mirror when you look in the mirror after a tummy tuck.
Mm-hmm.
But you want it slightly lifted. A lot of women, it's lower than where it should be from an ideal aesthetic standpoint. But you don't want it to be too high or too low. So it's something that is really determined by a woman's anatomy in terms of the size and shape and position.
Okay. Yeah, I'm not sure what my belly button looks like. I haven't seen it in a long time. Even from when I was overweight, it was kind of like hidden away, and now it's like kind of hidden away and facing down with the loose skin. So I think my only concern with the belly button is I would prefer for it to not look like a coin slut, if that makes sense.
Right. No, I understand exactly what you're referring to. If it's too narrow,
right, or an outie.
like you said. No, if it's an innie to begin with, it'll be an innie afterwards. You just don't want it to be too narrow. Like you said, you don't want it to be a coin slot.
Correct, yeah.
But in general, it's an oval shape. Some women want it to be more rounded, which is possible. But in general, the size and shape of the belly button after tummy tuck, it resembles the size and shape of what you have to begin with. So when you're looking in the mirror and you pull your abdominal skin up, you can kind of get an idea as to, you know, what your belly button looks like.
Okay.
And that's kind of what we go by. That's what we go on when we bring the belly button to the surface of the skin. We do liposuction of the flanks. It's sort of what I call the waist.
Okay.
Because even though you've lost a significant amount of weight, there's oftentimes some residual fat deposits in those areas. And so tummy tuck, whether it's circumferential body lift or extended tummy tuck, is usually done along with liposuction of the flanks.
Okay.
And it just is something that is done to improve the overall aesthetic results. Okay. And here we call liposuction microbody contouring. It just means that we use very fine cannulas or suction tubes, which improves the overall results.
Okay.
But in general, tummy tuck is usually done along with liposuction of the sides. We call it the flanks, I call it the waist, but it's just something that is generally done at the same time to improve the aesthetic results.
Okay, great. I think my only concern, the only thing that I'm like, I hope it doesn't look like this, and I know it just depends on the individual's anatomy, but I have seen some before and afters where they look extremely boxy afterwards. And since I have lost weight, and I also think that it's due to my workouts and lifting, I've been able to kind of shape my body into an hourglass shape. And so I'm just hoping that with the lipo that it's not gonna reduce that shape. But if it's off on the waist, then I feel like that would enhance it. I just want to make sure that my hips aren't gonna be smaller from lipoing.
Right, I understand exactly what you're saying. The way the shape of women's bodies after body contouring, it should accentuate their curves, and I think it's really a matter of how the procedure is done. You know, some surgeons accentuate a woman's curves, other surgeons make women, boxy. It really shouldn't be that way. So a lot depends on how the plastic surgeon approaches body contouring in women. So you really have to, someone like myself, I accentuate a woman's curves, not reduce them, and that would be counterproductive to all the hard work you've done yourself in the gym to take your curves away.
Right.
So, it's a difference in the approach to body contouring.
Okay.
I accentuate a woman's curves, not take them away.
Great. That's a relief to hear.
In terms of staying in the area, ideally, if you can stay about 2 weeks, that allows us to see you periodically during that time. As I mentioned, the drains stay in for about a week, and I like to check women a few days after the drains are removed.
Okay.
So if you can stay in the range of 10 to 14 days, that's preferable.
Okay.
That way we can see you periodically during that initial stage of the healing process. Usually we see people the next day, and then 5 to 7 days post-op, and then we like to check a woman one last time before they fly or drive home.
Okay.
You don't have to make a trip here to see me before surgery. If you're able to do that, it's perfectly fine, but not absolutely necessary. But in general, once you know the date of your surgery, we like to have you come in, even if it's the day before, just to have me look at your body, go over everything, answer any questions that you may have. Most women stay at a hotel nearby, or with a friend or family member. Although it's not absolutely necessary to come in to be seen, if you're able to, that's even better, but it's not absolutely necessary.
Okay.
We do prescribe pain medication, which you can take if you need it. We also prescribe muscle relaxants if we're planning on doing muscle repair. If that's the case, many women find the muscle relaxants to be equally as helpful, if not more so, than the pain medication.
Okay.
We also prescribe antibiotics that you take for 7 days post-op.
Okay.
But you don't have to take any medication before surgery. But we give you a list of things not to take for 10 days before and for 10 days after. The most important things to avoid are aspirin and ibuprofen. Your body goes through a healing process after everything we do in plastic surgery. Most of that healing takes place in the first 6 weeks. And so we do, in general, see people periodically throughout the healing process. Sometimes it can take as long as 3 to 4 months for someone to be completely healed. But you do have to take some time off of exercise, usually about 6 weeks.
Okay.
All you can do in the meantime in terms of activity is just a little bit of walking each day.
Okay.
But you do have to go into this, keeping in mind that you can't really do any cardio or weight training for at least 6 weeks.
So when somebody gets a tummy tuck, does that also lift like their pubic area as well?
Yes.
Okay.
Yes, that gets lifted and tightened quite a bit.
Okay. Awesome.
So that's a nice benefit of tummy tuck.
Okay, cool. Awesome. Well, I think that's all of my questions for you. Thank you so much for being so thorough and answering those and taking the time to speak with me. I really appreciate it.
You're welcome.
All right, so let's go ahead and talk about how much this one was going to be. Now, if you guys watched my previous videos, the first few quotes that I got, the highest quote that I got, I think was like $27,000, and then I got a $22,000 quote, and then I got another like $26,000 quote from different doctors. So I am going to share this quote with you guys, all right? So for the tummy tuck and the breast lift, that quote was for, it was $22,085, and it would be half down before and then the other half at the day of your surgery. So $22,085 was the price for that. He seems like a fantastic doctor, but it's just not realistic for me. My price range that I felt comfortable with going into this was like $8,000 or $7,000. So I'm like, are there any doctors that do this for like $8,000 with good work? Or do I need to go to Mexico? I'm not going to Mexico, but they'll do it in Mexico for like $4,000. So 22,000, guys, it's just it's a lot. So then I was like, okay, well, what about if I don't do the breast? For the quote that was just the tummy tuck, it came out to $15,585. I'm like, that's like closer to where I want it to be, but it's still like almost double that I wanted to pay for this. And then I also have to take in consideration this doctor is all the way out in Irvine, California. So if I want to go to Irvine, California, I'm gonna have to pay for plane tickets, which I actually made notes because I was like,
okay, girl, let's sit down and see if we can actually make this happen.
All right, so for my flights, it's for me and Julio because Julio would be taking care of me. It is $1,100 round trip. All right, then for an Airbnb or a hotel and a rental car, that's another $1,500. And then there's another expense that comes with tummy tucks, and that is getting the lymphatic, I don't know, the massages that you get. If you don't know, now you know. You get massages after you get a tummy tuck because you have to like get all of the fluid. I was gonna say oil, like we're changing a car. You like massage it and like fluid comes out of your drains, and it just helps with swelling and it helps you heal faster. I'm gonna do a whole nother video on those massages once I feel like I am ready to explain it to somebody else because I'm still in the learning phase myself. So if you think of that $15,500 plus another basically $3,000 on top of that, that's coming out to, it's just too much, guys. It's too much. And as much as I love this doctor and I know that he would do absolutely amazing and beautiful work on me, it's just outside of my price range, and I am not going to put myself in that much debt. I do feel like there is another option for me. There is another doctor for me, and spoiler alert, I did find another doctor who I really like his work. He is a board certified plastic surgeon. That's something that I really wanted to make sure that a credential that my surgeon had. So he is doing it for a price that is incredibly reasonable for me, and I actually booked my surgery date. So guys, we have a surgery date, which is why I said in the beginning of the video, I have 12 weeks to come up with $4,000. So yeah, I put my down payment on it, and I need to pay the rest of it on April 25th, the day before my actual surgery. It's happening. And this doctor is right over in Houston, which is like a hop and a skip away, 3 hours away from here. So Julio will take off only 5 days of work compared to almost 2 weeks of work. So that is another big plus, and I'll be closer to home, and I won't have to fly while I'm not being able to stand upright. You know what I mean? Know what I mean? So yeah, as far as sharing who my doctor is, I don't know if I can necessarily do that right now. You guys know that I would absolutely share who my doctor is, but I want to talk to him first to make sure that he's okay with me documenting my experience, right? And if he's not, then that could be like a red flag, but I don't see why he wouldn't be. But I need to actually have that conversation. So we are moving forward with this journey, all right? So April 26th is my surgery date, so let the countdown begin. In my next video, I'm going to be telling you guys exactly how much the cost of my tummy tuck is going to be with this doctor in Houston. I'll be sharing my doctor information. I'll be sharing any pre-op stuff that I'm doing, things that I'm buying to get ready for my surgery, like vitamins and all of that good stuff. And yeah, let the journey begin. Guys, if you want a cool t-shirt, okay, that has cute designs on it, please consider going and purchasing a shirt from my website. Again, 100% of that money is going to my tummy. Again, 100% of that money is going to my tummy tuck piggy bank, as well as one-on-one consultations, like one-off packages where I make a program for you and you like go away and do it, or any workout guides, or the water bottles right now. 100% of the money that I make from that is going towards my tummy tuck. So if you guys want to help a girl out, okay? It's like, do I really think I can save that? I can come up with that much money in 4 weeks. I'm putting it into the universe. Like, it is going to happen. My mind is made up. It's gonna happen. So boom, I gotta hustle. I gotta grind, okay? Another thing that I'm doing right now to try and boost my income to pay for this is I'm almost done with it. I have a seminar. It's a 3-part seminar, and there is so much detailed information in this, which I'll have more information on it for you guys in my next video, but I am excited about this. I wish this is the type of thing, when I first started trying to lose weight, this is the type of thing that I wished that there was at an affordable price, like where I can go and get all of the information, no BS, no one's trying to sell me any products, from somebody who did it, and basically laying out like, this is what I did, this is the mindset that I had to be in, and this is the crap that happened along the way to avoid. So that's basically what this seminar is gonna be. If you guys are interested, let me know down in the comments, because any comments you put on the video helps the channel. If you guys are not subscribed, please do so. You can do all of the things. Be a YouTube fairy, like, subscribe, heart it, comment, all of the things. Share is a big one. All right, guys, I love you all, and I hope that you are doing well, and I will see you guys next week with my video about what is up with the tummy tuck and the specifics. As always, guys, remember, you hold the power in your hands to make any changes in your life that you want to make, and I will talk to you guys later. Bye, guys.